Well, good morning and welcome to the Elkridge 50 Plus Center right here in Howard County. It is an honor to have you here today. I'm Calvin Ball, your Howard County executive, and I'm delighted to welcome you to our very first in-person prescription drug affordability forum for this year. In 2019, shortly after taking office, I joined Vinnie DeMarco and many others with the Maryland Healthcare Coalition to support state legislation to control soaring drug costs that make prescription drugs and fight to make prescription drugs more affordable for our residents. We knew that prescription drug prices were hurting people across Howard County, and we knew that we needed to stand up for Howard County and the rest of the state of Maryland, so that Marylanders could afford their medications. I was thrilled when the board was established, helping state and local governments reduce expenditures on certain high-cost drugs while also freeing up public funds and other needs, such as for education. Maryland is a proud home to the nation's very first Prescription Drug Affordability Board, which is working hard to make high-cost prescription drugs more affordable for Marylanders. We are thankful that the board's initial focus on making prescription drugs more affordable for state and local governments is having an impact. This will provide meaningful relief for taxpayers and may free up budgets to provide increased county services. But we all understand that all Marylanders need access to affordable prescription drugs. Many Marylanders are forced to choose between their medication and other necessities like rent or groceries. 1/3 of Marylanders report not taking their medication as prescribed due to cost. While this board is working diligently to address the high cost of prescriptions, anyone in need of assistance with their medications should call 211. Again, if you're in need of help with your medications, please call 211. You can get assistance with medication discounts, financial help for prescriptions, or existing patient assistance programs. Howard County has been and will continue to be at the forefront of healthcare innovations for our residents. We are among the top 10 healthiest counties in the nation, according to rankings by U.S. News & World Report. We are also one of only 4 jurisdictions in the nation to receive the prestigious Robert Wood Johnson Culture of Health recognition in 2021, which highlights innovative communities for working at the forefront of advancing health, opportunity, and equity. We're honored to be the first jurisdiction to host these important conversations held around the state. And while we have already made progress building a healthier and a stronger community with access to quality care, we can, and together, we will do better. Our hope is that these forums will highlight the incredible burden of rising drug costs and inspire continuous action from the Prescription Drug Affordability Board. And I am incredibly grateful for all the work that they are doing and continue advocating for finding solutions for Marylanders. And I want to give a special shout out before I turn the mic over to him. Vinnie DeMarco, he continues to stop at nothing to help ensure that Marylanders live their very best, healthiest lives. He has been a friend, an advocate, and a warrior for many years, and he will continue to be so for many years to come. Vinnie DeMarco?
Thank you. Oops. Thank you, Mr. County Executive. This is a big hand for County Executive Calvin Ball. You know, in 2019, Maryland became the first state to have a Prescription Drug Affordability Board, and everyone said we couldn't do it because Big Pharma had always stopped laws like this all across the country. But we did it, and one of the main reasons, because of this man, because of Calvin Ball and his really hard work to make sure that the Maryland General Assembly knew that we needed a Prescription Drug Affordability Board. You and your colleagues, the other county execs, and the mayor of Baltimore worked very hard to enact this law, and we're very proud that it's there and that it's in place and working. And I want to start by saying today is the first, as the county executive says, of our in-person events around the state. We had a webinar that was by Zoom on Monday evening, featuring the health chair, Jocelyn Pena-Melnick of the House Health and Government Operations Committee, and Senator Chris Van Hollen. And the two of them talked very, very eloquently about the need to have prescription drugs more affordable for people. Drugs don't work if people can't afford them. So today we're going to do a couple of things. First, most importantly, give you an update on where the Prescription Drug Affordability Board is. And I want to introduce first to do that Dr. Andrew York, who's the executive director of the board, and he was appointed early by the chair, Van Mitchell, and is one of Van Mitchell's wisest decisions. As a lawyer and a pharmacist and a person who's worked at the federal government on prescription drug affordability, Andy really knows how to make this progress happen. And over the last couple of years, he has done a lot to make our board work and to be a leader of the nation. I know other boards are following his example, and I tell them all, you can't have Andy. He is ours. And so with that, let me introduce Andy York, whose wife is about to have a third baby, so he might be called away any second. And Andy, all yours.
Thank you to Vinny and the Maryland Healthcare for All team, and thank you to County Executive Ball, and thank you to the center here for hosting us. The Maryland Prescription Drug Affordability Board is an independent state agency that's dedicated exclusively to making prescription drugs more affordable for Marylanders. And this is a really exciting time for the board because we have a number of different policies that we're starting to move forward. So we were created, one of the things we can do is cost reviews on drugs that may cause affordability challenges, and then also setting upper payment limits for drugs that are deemed to be unaffordable. So it's an exciting time because we are now at the process of finalizing the cost review process. We have regulations that are coming out on September 22nd, and we're looking forward to public feedback and comment on those regulations. And one of the things we're most excited about in those regulations is it creates a process for the public to let us know where they are, when they are having trouble affording their drugs. So we will be rolling out a process for the public to let us know when drugs are unaffordable to you. And we'll use that opportunity to look at additional policy interventions, but then we'll also try to help those patients in any way that we can afford their prescription drugs. So we do look forward to directly working from the patients because that is the most important voice here. And then also on our board meeting on September 18th, the board set the pathway for setting upper payment limits. So the way we do this is through a document called our Upper Payment Limit Action Plan, which basically talks about how do we identify the drugs, how do we go, like, what does it mean to set an upper payment limit? So how do you actually set that number? And then how do you make it flow through the supply chain? And I think the board came away with three pretty big or clarifying decisions there. The first part is that they want it to be very clearly make sure that any work that we do around upper payment limits is felt by the patient. So that was very clear from the board, and that gives us a lot of direction on how you would actually implement the upper payment limits. The second thing is that they want to take a number of different factors into consideration when they set that upper payment limit. And then finally, they also want to make sure that we effectively implement these upper payment limits. So basically make sure that we do it in the most direct way possible to ensure success. And that can include through things such as rebates, and I'm happy to go into the weeds on what that actually means. But that is all going to be used to put this upper payment limit action plan together. That plan will then go before the Legislative Policy Committee, and then we'll be putting out regulations on that. But all to say, we're hoping to be able to move forward with this authority, in the near future. And then the last thing I'll say is just that, while our most direct authority is around these upper payment limits, the board thinks that these are a important and essential tool in the toolbox, but not necessarily a silver bullet. So we'll continue to look at other policies that we can to help Marylanders afford their prescription drugs. So we're always looking for feedback from the public. Again, the patient voice is what we're looking for most, and we look forward to continuing to work for you. So thanks again for the opportunity to update you all on our work, and we hope to hear from you soon. Thanks. And
unless he's called away, Andy will be around for questions. So Thank you very much, Andy, for all your great work. A couple of things. You heard Andy say stories that you all have about how high-cost drugs are hurting you is something the board wants to hear about. And they're going to set up a system to hearing from you soon. In the meantime, there's a packet that we have given out, and those of you who aren't here, if you might want to get one from these chairs, there's a QR code where you could go onto the QR code and get your message to us that we'll pass it on to the board of how high-cost drugs are hurting you or your family. So we want to hear from you how high-cost drugs are a problem, and we want you to let us know if they are. Also, I want to recognize a couple of key people. We have a board member, Glenn Schneider, who's also at the Horizon Foundation here. Let's have a big hand for Glenn. Maybell and Carol Fisher, two of the great leaders in our county. We have some elected officials.
Delegate Pam Gazzoni.
Delegate Pam Gazzoni, you want to stand up, Delegate? Thank you, Delegate, for being here. Delegate Gazzoni has been one of our great supporters on prescription drug affordability and other health issues on the Health and Government Operations Committee. And your chair did a great job on our webinar. Yes. Thank you very much. Did you want to say a few words, Delegate? Okay. Thank you for being. Any other elected officials? Okay. Well, and I want to also recognize Liz Bannock, former head of Marylanders to Prevent Gun Violence. Thanks for all you do on that issue. In addition to supporting what the board is doing to make high-cost drugs more affordable for state and local governments, we announced on Monday that the Maryland Healthcare for All Coalition is working to make legislation get enacted in 2024 to expand the authority of the board to allow them to make high-cost drugs more affordable for everyone. And I'm proud to say that's on the front page of the Sun today. Drug plans on docket for next session. So we hope that this will be a priority, and we'll be coming right to your committee, Delegate Gazzoni. So we'll be happy. Great. We'll be happy to talk with you. And Mr. County Exec, as in the past, we look forward to you and your leadership. We really want to make Maryland the leader. Since we enacted a prescription drug affordability board, several other states have. Two of them, Colorado and Minnesota, have enacted laws like we want to get done so that the board can make high-cost drugs more affordable for everyone. And as we speak today, Michigan is holding a hearing on a prescription drug affordability board. Governor Whitmer of Michigan has endorsed it. So we're spreading around the country. So we want to build on the progress we made. But in Maryland and everywhere, none of this progress could happen without AARP. And we are thrilled to be working closely with AARP on this issue here in Maryland and across the country. And I want to recognize, to speak for a couple minutes, is Jim Gutman, who's from Howard County and a top AARP leader. And as he's going to point out, some of the folks in Howard County, the SHIP program, which can help you sign up for health care, are here, and the Insurance Administration to help you if you have individual problems. But I want to introduce Jim Gutman to talk with you a little bit about AARP's role. Jim?
Thanks, Vinny, and it's a delight to be here for a number of reasons. This is my home county. I'm also a volunteer Medicare prescription drug plan counselor during the open enrollment season for the SHIP here. And I work with Therese, who's here with Anita, and I hope you'll visit them while you're here. They do great work. I look forward to working with them again. I'm also on the Stakeholder Council with Glenn Schneider, and it's great working with him as well. This, as Vinny said, as Andy said, is a very important time for the PDAB. We now have the proposed regulations for the upper payment limits. This is the first concrete step that's going to make a big difference. And the board, with extremely limited resources, have been doing an exceptional job to get us to this point. And the fact that they're not only working on this, but working on something called reverse auctions that could also have an impact by lowering the cost of obtaining pharmacy benefit management services, and the benefit of that will also flow down to individuals. That's another great thing that's happening. Vinny also stole my thunder a little bit about needing, still at this stage, to get the specifics on your personal experiences with unaffordable drugs. There's no substitute for having this kind of thing. I get it when I'm counseling a ship, but all of that is confidential. I can't use that information. We need information we can use and to help us go even further in this process as we need to do. The board is, and the meeting this week confirmed that, is focusing on all the right things, especially patient out-of-pocket costs. That's where we need to make a difference. That's where this board is going to help us make a difference. And the legislation in the next General Assembly, which I'm very proud to say our AARP Maryland Executive Director, Hank Greenberg, said on Monday night AARP expects to support, is going to be real important in that. That will enable, over time, the PDAB to make a bigger difference by extending its authority to all Maryland residents. Again, the PDAB is the best thing that's happened on drug costs to Maryland. I hope you all will support it, and I look forward to working with it as long as I can. Thanks. Right.
Thank you very much, Jim and AARP. And I want to just mention that we are on Facebook Live. My colleague Suzanne Schlotman and intern Lila Martin have gotten us on Facebook, so people out there are watching also. I want to emphasize again, if you have a story of yourself, a friend, or a family member who has been hurt by high-cost drugs, let us know, and we'll pass it on to the board. And the Stakeholder Council, comprised of Jim and Glenn and other great people, will look at that and take that into account in deciding what drugs to make more affordable for people. In addition to AARP, we've had great support from the NAACP. Thanks, Jonathan McKinney, for all the NAACP support for what we've done. But one of the most important groups of people to make this progress happen and to overcome the power of the big drug companies has been the faith community. And I'm thrilled that Reverend Dr. Sandra Conner is here, who's the president, first woman president of the Baptist Ministers Conference, Night Conference of Baltimore and vicinity, and she'll talk to us a little bit about the faith perspective, then we'll open it up questions and discussion. Reverend Dr. Conner?
Good morning, everyone. How are you? Great. This is indeed a great day, and it's good to see you all here today. I want to just simply say to you that we realize from the faith community that drugs, if you don't have them, it's not good for you in many ways. One, we won't get to see you in our services on Sundays. That's a quickie, but not necessarily the reason. We realize that making sure that you're whole and that you're feeling up to par both spiritually and physically is a more obligation for us to make sure you have all that you need to be able to move and be successful in this life. We work very hard and diligently to support the initiatives that come out from not only Healthcare for All, but anything that's going to relate to your whole being, your holistic opportunities and things that you need to make your life easier from a faith perspective. We want to let you know that we are grateful for the fact that we have a prescription drug affordability bill. We get the calls as well as the AARP and other folk about the stories that are going on about the fact that our members cannot pay for their bills. We get the stories about the fact they've got to choose whether or not they're going to pay their rent, they're going to do other social needs, or forego their medicine, and we would not want to have them forego their medicine. So this is very important to us as a faith perspective, but it's also important to you as individuals. Now, you may say, I don't have that issue. That's not my problem. I'm doing okay. Great, I hear you. But for me, what I'd like to suggest that you do, that you take this information. There might be someone else that you know that is not perhaps as fortunate as you are. Take this information, take the pamphlet that's here and share with somebody else, that they too might be able to use it for their benefit, that they might too to know that if I have a problem, I can dial 211. If I have a problem, there are initiatives and things that are going on. So I encourage you all. My message to you all is, if you see something, say something. If you know anybody else is hurting, that's our moral responsibility, to care for one another. I encourage you all to take this information, do what you can, expand it beyond the states of Maryland, because as you hear, Vinnie DeMarco and others are going beyond. Call up a family member. Let them know, have you heard? There's a new plan, a prescription drug affordability that's going on. And we thank God for this opportunity to be able to do what we do to make a difference in the lives of our people. Thank you.
Thank you so much, Reverend. I just want to make clear to everybody, this is a national problem. We all know that. We were thrilled to have Senator Chris Van Hollen with us on our webinar Monday night, who talked about President Joe Biden, Vice President Harris's Inflation Reduction Act, which is helping so many people on Medicare afford their prescription drugs. It is a tremendous step forward, but we need to go beyond that. And Senator Van Hollen has introduced national legislation called the We Paid Act, which says if a particular prescription drug was based on research paid for by the federal government, they can't charge whatever they want. We've already paid for the research. They have to be limited on their price. So that's a great bill that he's proposing. But in Maryland, we want to continue to lead the nation with the Prescription Drug Affordability Board. You've heard today about what the board is doing. Thanks very much, Dr. York. And what we want to do. We want to expand the authority next session, and we're going to ask your help to reach out to legislators here in Howard County to urge them to support expanding the authority of the board next session so the board can make high-cost drugs more affordable for everyone.